Safeguarding children with disabilities and their families in communities is paramount to ensure their well-being and protection. Here are several ways communities can work towards this goal. Awareness and education. Raise awareness in the community about the unique challenges faced by children with disabilities and their families. Provide education and training to community members, including teachers, healthcare providers, law enforcement officers, and volunteers, on how to identify signs of abuse or neglect in children with disabilities and how to respond appropriately. Accessible support services. Ensure that support services for children with disabilities and their families are accessible and available within the community. This includes mental health services, counseling, respite care, and support groups tailored to the needs of children with disabilities and their caregivers. Collaborative partnerships. Foster partnerships between community organizations, government agencies, schools, healthcare providers, and advocacy groups to create a coordinated response to safeguarding children with disabilities. Collaboration can help ensure that resources are effectively utilized and that gaps in services are addressed. Empowerment and advocacy. Empower children with disabilities and their families to advocate for their rights and access to services within the community. Provide support and resources to help families navigate systems of care, access educational opportunities, and advocate for inclusive policies and practices. Inclusive recreation and activities. Promote inclusive recreational activities and community programs that allow children with disabilities to participate fully and safely. This may include adaptive sports programs, accessible playgrounds, and inclusive events and festivals. Accessible transportation. Ensure that transportation options within the community are accessible to children with disabilities and their families. Accessible transportation facilitates access to healthcare, education, recreational activities, and other essential services. Emergency preparedness. Develop and implement emergency preparedness plans that specifically address the needs of children with disabilities and their families. Ensure that emergency shelters, evacuation procedures, and communication systems are accessible and inclusive. Addressing bullying and discrimination. Take proactive measures to address bullying, harassment, and discrimination faced by children with disabilities within the community. Provide training and resources to schools, community organizations, and law enforcement agencies on how to prevent and respond to incidents of bullying and discrimination. Supportive housing. Ensure that housing options within the community are accessible and supportive of the needs of families with children with disabilities. Accessible housing can promote independence, safety, and inclusion for children with disabilities and their families. By working together to raise awareness, provide support services, and create inclusive environments, communities can help safeguard the well-being of children with disabilities and their families, ensuring that they have the opportunity to thrive and participate fully in community life.